Hey there, this is Dr. Stephanie Ganter, and this is Dr. Bob McNeil. Together, we are Steph and Bob, and we're between two teeth. I'll have you guys know that today we're going to be talking about finding your voice. I could be talking in a very low voice here, and Bob could be talking in a very high pitched voice, kind of like this. You know, it's not every day that we actually look at. I'm sorry, did you have something to say? Good. It's not every day that we look at how our voice sounds and how talking in a deeper voice can be maybe more authoritative.
You struggled to find your voice in the first 2 years of practice.
So that was kind of a tough thing for me to hear, let alone accept. And for me as a female, I feel like females are supposed to kind of have a really like a higher voice, maybe a little bit impatient, and I feel like we should.
That voice is terrible.
Well, that's not nice, man. I'm just trying to tell you what I feel like is expected. And, you know, at the same time, I don't think I can go around and talk like I'm from Texas or I got a big, low Southern drawl now. I don't think that would be very.
From Texas.
I am from Texas.
I'm actually from Canada. I'm wearing a Canadian tuxedo.
Are you from Canada?
This is what a Canadian tuxedo is. And I'm thankful that I'm not holding the tooth this time.
This is the first episode where we decided Scotch tape would do a much better.
My arm was bothering me.
Weakling.
But back to the voice there.
Back to the voice. You know, your voice, your tone and pacing. I could start talking really fast and get really excited about a topic and you lose me. Or I could slow down something. I could emphasize something. But then maybe I lose you. Maybe it's too slow. You know, with our patients, we try to match, and it's called mirroring, and we try to mirror whatever they are. If you have a patient that's really anxious and excited, use my tone and pace to kind of slow things down, kind of
in a great
relax.
Technique for that, meeting them where they are at.
Absolutely.
And I know we've talked about that in practice, and we have mirror neurons in the brain. It basically says likes. And sometimes you have to be how the patient is and then slowly take them to where they want to go. But finding your voice, tell me more about that.
So let's talk about post-op calls with patients. And one of the things that I struggled early on with is at our office, we call our patients at night. We want to check in on them, make sure they're doing okay. And one of the things that I found that when I call patients at night, and I didn't even recognize it till you started kind of poking fun of me a little bit when I was calling them, is I have a phone voice. And I've had friends that have told me I have a phone voice. You know who you are. You know, dating back to high school, I believe. And it's crazy because the minute I get on a phone, suddenly I'm a different person.
You talk a lot higher.
Maybe that's so rude. Yeah. So rude. But it's true.
You either go super high
talk to me
super low.
Well, so talk to me about how does it come across on a guy end of things or a patient end of things when you have your doctor talking in a very high-pitched voice on the other end of the phone? Does that convey confidence at all?
No.
So what does it convey?
The opposite.
The opposite. And this is things that as a female, I really don't want to sound like a guy.
And I like your comment that you made. You know, we all think that it's just communication is the words that we say, and it's not. It is the volume, the tone, the pacing, as you mentioned. And that's what can get you into trouble. And you have to watch too. You don't want to come across as patronizing to patients because they can really pick up on that.
Absolutely. And that is something that it's been nice to have. Just, you know, you'll call me out on it sometimes as well. I will come across almost in a patronizing tone and I don't even know it. It might mean that I'm actually really nervous or you've threatened my ego somehow. And it comes across as though I guess I come across patronizing. But if I go back and I look and I think about it, I'm like, man, maybe that was patronizing.
And I think from a communication standpoint, communication is probably one of the most important skills that will affect how you do in your practice. Quite frankly, how you do in personal interactions with people and just your own level of effectiveness. Crazy important, and it's a lifelong thing to work on.
Oh, I couldn't agree more. Another classic example, and it's so important for a young doc to hear this and don't be afraid to critically evaluate yourself. have someone come in the consult room with you and listen to you. Be a fly on the wall. You're good at being a wallflower. That's his nickname in the office, is wallflower.
Hardly ever say a thing. I'm just quiet as a little church mouse.
Oh yeah, for sure. And the thing here is if you are, the patient judges you the moment you walk in the room. If you are young, for me, being female, I am judged positive or negative.
You're not tall.
Unfortunately, I'm a short female. I can say that. You can't say that, but I can say that. And it is challenging to have, when you have a doctor in the room who's going to start doing a procedure on you, or you are putting your trust in them to take care of your mom, your dad, let alone your child. You want somebody who is confident, authoritative, who's done this a million times, and there is going to be one outcome, and it's the outcome you want.
And there's unique challenges for people who are new to practice.
And this is one of them, because the things I just mentioned about concerned parents, maybe a nervous patient themselves coming in, if you can't sell your confidence to them, your sedation will be tricky. The way they are going to be in the chair will be tricky. Their post-op will be tricky. They may not even book treatment with you.
And I would say not just your level of communication, but picking up the signals that they are giving you by becoming a student of analyzing their body language and knowing when you have to pause and back up and maybe say
Absolutely.
to them, does what I'm saying make sense to you? Do you have any questions about that?
And I'm glad you brought up, so a couple points you just made. Feedback from the patient. This is happening real time, and the more fluent you are with body language, the better you will be able to adjust and adapt.
And they're not going to say it verbally.
They will never tell you.
It is the eyebrows. It's the position,
For me, when they are looking at me, I either get two looks. One, I get something similar to that, where they're just like not blinking, like they don't trust me to be in the room with them. Yeah. And then the other sign of distrust is downturned eyes, body language that is closed off. I've asked them a direct question, but they are talking at the floor, or they're using a very soft voice, and they don't want to talk to me, and they don't want to talk anything. They just don't want to do anything there. And it's a challenge. Another challenge is having some patients do not want their authority challenged. So you've got to walk a line of being confident, but not more confident than they are.
Control freaks.
Yes.
And usually I'll call it out. And I say, I have some challenges myself with being a little bit of a control freak. And it will have patients that want to be sedated, but don't want to be sedated. I don't want to lose control, but I don't want to remember anything about what's going to happen. And that's when I'll usually say, oh, do you have control problems? Because I do. It kind of sounds like that's what's going on there. And so labeling it, calling it for what it is, and say, how are we going to together figure out how to best manage things?
How important is active listening in the consult room?
I do not like to listen.
That's apparent.
In general.
I think everyone's seen that's apparent.
Yes, in general. But of course, and it's with your ears, but also with your eyes, like you talked about. You are getting so much feedback from the other human on the other side. And it's just whether or not we're going to be receptive and perceptive of those
very nice
signals. Yeah.
Did you get your MBA?
I did, yeah.
Okay.
Yeah. It was so
all right.
I
thought so.
The MBA, we did a lot of finance, operations management, statistics, but the courses that I loved the most were actually self-awareness. It was human interaction.
Huge topic, and
it was communication.
I'm gonna cut you off there because you've made some great points, and these are going to be podcasts we will do in the future when we go into emotional intelligence, self-awareness. All these are communication strategies to not only better understand yourself.
Talk about them now.
Oh, I know, but you don't get to.
Okay.
And better understand your patients.
That's the way life goes.
Thanks for tuning in today.
Hit subscribe.
Please, to our channel. Put comments in the box. And I'm your host, Stephanie, and this is Bobby.
Am I a co-host?
You're a co-host. We'll make him co-host today. And this has been Between Two Teeth. I hope you've enjoyed this segment on communication. Remember, your patient is judging you the minute you walk in the room, and you have the power to make that a great or not so great experience. Thanks, guys.
I like that.
Yeah.